As physicians, our ethical responsibility is clear: to provide the best possible care that is safe, effective, and evidence-based. Because of this, a growing number of clinicians and healthcare systems are adopting patient blood management, or PBM, as the new standard of care. Why? Because a substantial body of evidence-based, peer-reviewed research demonstrates that PBM produces outcomes comparable to, and often better than, transfusion-based care. Because of this strong clinical evidence, leading organizations, including the World Health Organization, the Joint Commission, and the AABB, formally recommend the implementation of patient blood management as a standard of care. Regarding risks, an analysis titled Transfusion-Related Adverse Reactions states, between 2013 and 2018, U.S. facilities reported 18,308 transfusion-related adverse reactions. 9% were severe or life-threatening. 23 resulted in fatalities. This retrospective cohort study of 23,969 elective surgery patients compared those who received a single unit of red blood cells with those who did not receive any transfusion. The results were striking. Transfusion of a single unit resulted in 3.94 times higher odds of hospital-acquired infection, 1.57 times longer hospital stay, and 1.42 times higher odds of 28-day readmission. What about patients who are critically ill? This systematic review, which examined 10 studies, states, a common finding among all studies was that transfusion of a single unit of packed red blood cells in the critically ill subject increases risk and may lead to increased morbidity and mortality. This leads to an important question. What is the difference between patient blood management and bloodless medicine? PBM minimizes transfusion exposure for all patients, but transfusion remains an option when clinically justified. Bloodless medicine incorporates the same core strategies with one essential difference. Allogeneic blood transfusion is not an option. Instead, evidence-based alternatives are used to manage care safely and effectively. The data is undeniable. PBM improves outcomes and saves lives. But is the adoption of PBM and bloodless medicine truly economically viable? According to a study published by Johns Hopkins, the answer is a resounding yes. The Johns Hopkins Health System achieved a 7.5-fold return on investment from its comprehensive patient blood management and bloodless medicine program. This remarkable return on investment was driven by a 10.9% reduction in blood acquisition costs, coupled with the net revenue margin generated by the Center for Bloodless Medicine and Surgery. These findings clearly demonstrate that PBM is not merely a clinical enhancement. It is a strategic, financially advantageous initiative that strengthens a hospital's economic performance. You've been presented with evidence that challenges long-held assumptions. For many clinicians, transfusion has served as a safety net. Yet the data now suggest that even minimal transfusion carries risk. That tension is difficult to ignore. But in the videos ahead, you'll see how patient blood management, supported by a multidisciplinary team approach, offers a stronger safety net, one grounded in the best available evidence. Patient blood management, a patient-centered, evidence-based approach.